It is really a pleasure on behalf of really Africa CDC and the Director General. I wish to convey my appreciations to the organizers for convening this timely discussion. It is really a timely discussion. And I have seen from the two presentations that we have made and heard also from the other colleagues who have already spoken that we are meeting really at a very important moment for the global health, right? Solidarity, once largely aspirational, is now being embedded in global frameworks, including the pandemic agreement. So the challenge before us is to ensure that solidarity becomes operational, measurable, and sustained. That is very important. And you guys have done a lot of work, and I have seen for the past 2 to 3 years that we have heard directly from policymakers, from researchers, from the civil society. But these conversations have grounded our understanding of solidarity in a real world experience. One message stands out from what I have heard from your two presentations, right? Solidarity must be built into systems before crises occur. It cannot be improvised during emergencies. In our context, as Africa CDC. So these discussions also have helped us, I think, to move from a broad commitment to more actionable principles. And we have seen the 8 principles that we have highlighted. But let me highlight a few. 1, equity in access must be deliberately designed without a pre-agreed mechanism. Access to vaccines, diagnostics, therapeutics will remain in vain. Solidarity requires predictable, transparent systems that ensure timely, fair access for all. Second, distributed capacity is essential to global health security. Africa's experience has shown that dependence on external supply chains creates systemic risks. Strengthening regional manufacturing, workforce capacity, and data system is not only a regional priority, it is a global public good. Third, solidarity must be grounded in mutual accountability. It is not charity, and someone also mentioned it already. It requires shared responsibility, trust, and transparency among all actors. Fourth, solidarity requires voice and agency. Those most affected must be meaningfully included in decision-making. This is essential for legitimacy and effectiveness. In this context, we welcome the inclusion of solidarity in these global frameworks and also the pandemic agreement. However, the true test will be in the implementation, translating the principles into practices. This will require clear governance, sustainable financing, and mechanisms for accountability. From the perspective of Africa CDC, we are working to operationalize solidarity through concrete initiatives, supporting food procurement, advancing regional manufacturing, and strengthening continental surveillance and data system sharing. Crucially, solidarity must reinforce regional institutions, which are central to delivering coordinated and context-responsive solutions. Looking ahead, we must move decisively from dialogue to implementation. This includes defining measurable indicators of solidarity, aligning, and this role really, I heard the colleague from Wellcome Trust mentioning the Lusaka agenda. The Lusaka agenda, from our perspective, is trying to address that one as well, aligning financing with agreed priorities and investing in systems that can deliver at scale. If solidarity is to shape the future global must be embedded in the architecture of our systems, not added in times of crisis. Africa CDC stands ready to work with all partners in advancing this shared agenda.